Hello, everybody. My name is Harmdeep Sethi, and this is the beginning and the preliminary lesson regarding radiology. For the first lesson of this medical unit, I will be discussing an overview in the concept of radiology and an introduction to how it will be used in the medical field through diagnostic machines. To begin, radiology is a medical practice of using high energy radiation waves to produce images and treat various systems and parts of the body. This field encompasses various imaging modalities, such as X rays, CT scans, MRI, and ultrasound, each offering unique insights into the different anatomical and pathological aspects of the human body. In this lesson, a brief overview will be provided into the two use cases of radiology: diagnostics and treatment. To begin, radiology is used in diagnostics to diagnose and detect various stages of and different diseases. There are the various types of machines used, each differing to the organ system and part of the body that it diagnoses. For example, X rays, one of the most prominent sources of radiology, works by passing high energy electromagnetic radiation through the body, with different tissues absorbing varying amounts of radiation. The remaining radiation creates an image on a detector, producing a snapshot of the internal structures. X rays are commonly used to diagnose conditions affecting bones and soft tissues, making them invaluable for detecting fractures, assessing joint conditions, and identifying abnormalities in the chest, such as pneumonia or lung tumors. X rays are particularly adept at identifying conditions and injuries in the skeletal system due to variations in tissue density. Dense structures such as the bones absorb more X-rays and appear white on the radiographic image, allowing for clear visualization of fractures, joint dislocations, or degenerative diseases and changes. The contrast between bone and surrounding soft tissues enables radiologists and X-ray technologists to pinpoint abnormalities in the skeletal structure with precision. In the chest, X-rays are instrumental in diagnosing conditions such as pneumonia or lung tumors by detecting changes in lung tissue density. In cases of pneumonia, areas affected by infection appear as opaque shadows due to the accumulation of a fluid or inflammation. Lung tumors, on the other hand, may be present as abnormal masses or nodules that disrupt the normal lung architecture, providing crucial information for early detection and treatment planning. The ability of X-rays to penetrate soft tissue and reveal various variations in density allows for the identification of a wide range of chest abnormalities, supporting comprehensive pulmonary assessments in clinical practice. Transitioning to a different diagnostic modality, CT scans, also known as computed tomography scans, offer a more detailed and three-dimensional perspective compared to traditional X-rays. CT scans utilize a rotating X ray machine and computer to create cross sectional images of the body. These images reveal intricate details of internal structures, making CT scans especially effective in visualizing soft tissues, blood vessels, and organs with higher clarity than conventional X rays. In medical practice, CT scans are extensively applied for diagnosing conditions in the head, chest, abdomen, and extremities. For head imaging, CT scans can be used for identifying abnormalities such as tumors, hemorrhages, or fractures with exceptional precision. In the chest, they excel in um, detecting lung diseases, evaluating the heart and blood vessels, and locating abnormalities in the mediastinum. Abdominal CT scans support and provide detailed views of the liver, kidneys, spleen, and gastrointestinal tract, aiding in the diagnosis of conditions like tumors, infections, or abdominal trauma. CT images are formulated through the reconstruction of the numerous X-ray cross-sections taken from different angles. CT technicians play a vital role in ensuring accurate positioning of the patient and obtaining high quality images, while radiologists interpret the results to diagnose and guide appropriate medical interventions. The collaborative efforts of CT technicians and specialists contribute significantly to the effectiveness of this imaging modality in providing detailed insights for comprehensive patient care. Transitioning to another imaging modality, magnetic resonance imaging, also known as MRI, offers a distinct approach, utilizing strong magnetic fields and radio waves to create detailed images of the body. Unlike CT scans, MRI does not use ionizing radiation, making it particularly advantageous for certain medical scenarios. MRI scans work by aligning hydrogen atoms in the body's tissue by returning a magnetic field and then disrupting this alignment with radio frequency pulses. As these atoms return to their original alignment, they emit signals that are detected by the MRI machine, generating detailed images of soft tissues, organs, and blood vessels. MRI is especially valuable for imaging the brain and central nervous system, alongside joints and soft tissues throughout the body. In neuroimaging, and MRI scans are crucial for detecting brain tumors, vascular abnormalities, and neurological disorders. They are also highly effective in visualizing soft tissue in the musculoskeletal system, aiding in the diagnosis of joint conditions and injuries. Additionally, MRI plays a key role in abdominal imaging, providing detailed views of the liver, kidneys, and reproductive organs. MRI scans and images are formulated through complex computer algorithms that analyze the signals emitted by hydrogen atoms. MRI technicians play a pivotal role in patient positioning and monitoring, ensuring the acquisition of high quality images. Radiologists interpret the results to diagnose various medical conditions and guide appropriate treatment plans. The absence of ionizing radiation in MRI scans make them preferable in situations where repeated image is necessary, particularly for certain populations such as pregnant women and those with thyroid and endocrine gland diseases and conditions. In summary, while CT scans use X rays and are adept at visualizing bone and dense tissues, MRI scans utilize magnetic fields and radio waves, excelling in detailed imaging of soft tissues and providing valuable information for a wide range of medical diagnosis. Usually, diagnostic technicians and practitioners aim to use CT scans due to diagnose diseases and conditions as a preliminary effort prior to the use of MRI due to the high cost, demand, and potential side effects of a surplus of MRI scans on the body. Now, transitioning to ultrasound imaging, this modality utilizes sound waves instead of ionizing radiation or magnetic fields to produce and create real time images of the body's internal structures. Unlike MRI, which is particularly adept and great at visualizing soft tissues, ultrasound is dynamic as it provides a live view of the organs and structures in motion. Ultrasound scans work by emitting high frequency sound waves into the body and detecting echoes as they bounce back. These ultrasounds, these echoes create detailed images of various organs and tissues in real time, making ultrasound especially valuable in obstetrics for monitoring fetal development and in assessing the cardiovascular system. In obstetrics, ultrasound scans are crucial for monitoring fetal growth, identifying abnormalities, and of confirming the viability of pregnancies. In cardiovascular imaging, they help assess blood flow and detect conditions such as deep vein thrombosis. Additionally, ultrasound is widely used for imaging abdominal organs like the liver, gallbladder, and kidneys, aiding in the diagnosis of conditions such as kidney stones or liver diseases. Ultrasound images are formed instantly on the monitors as the sound waves interact with tissues. Ultrasound technicians, also known as sonographers, play a pivotal role in operating the equipment, adjusting settings, and capturing the necessary images for diagnostic purposes. Radiologists and other specialists interpret these real time images to diagnose conditions and guide appropriate medical interventions. In summary, while MRI provides detailed images of soft tissues using magnetic fields, ultrasound excels in dynamic imaging using sound waves, offering real time views of moving structures. The choice between these two modalities depends on the specific clinical requirements, the area of the body being examined, and the need for real time visualization versus detailed static imaging. Now, let's move on to the role of these technologists and technicians. Technologists, also known as and referred to as radiographers or X ray technologists, are integral to the diagnostic processes involving various imaging modalities such as X rays, CT scans, and fluoroscopy. These skilled professionals operate the imaging equipment, position patients for accurate imaging, and ensure high quality images are obtained. Their expertise extends to adjusting radiation doses based on the specific imaging requirements while maintaining patient comfort and safety. Radiologists, on the other hand, are medical doctors specialized in interpreting medical images. They play a crucial role in the diagnostic process, analyzing images produced by radiologic technologists to identify abnormalities and provide accurate diagnosis. Radiologists collaborate with other healthcare professionals, such as referring physicians, to guide patient care and treatment plans based on the imaging findings. Their extensive medical training and knowledge of various medical and imaging modalities contribute to the comprehensive understanding of the patient's conditions. In summary, radiologic technologists are hands-on professionals that are responsible for acquiring high-quality images, while radiologists bring their medical expertise to interpret and analyze these images, ultimately contributing to the accurate diagnosis and effective treatment of patients. And to finish off, I'll provide a brief overview of radiation safety and protective measures. Ensuring safety is a paramount concern in the field of radiology. Radiologic technologists adhere to strict protocols and safety measures to minimize radiation exposure for themselves and patients. This includes the use of lead aprons, thyroid shields, and other protective gear, as well as in maintaining a safe distance from the radiation source during imaging procedures. Radiation safety measures extend to the implementation of optimization techniques, where technologists adjust equipment settings to achieve diagnostic images with the least amount of radiation necessary. Regular training and education on radiation safety protocols are imperative for radiologic technologists to stay informed about the latest practices and technologies that enhance patient safety. Additionally, radiologists can contribute to radiation safety by carefully reviewing imaging requests and ensuring that the benefits of the diagnostic information outweigh potential risks. They provide guidance on alternative imaging modalities with lower radiation exposure when appropriate. Collaborative efforts between radiologic technologists and radiologists in adhering to strict safety guidelines underscore the commitment to minimizing radiation exposure and prioritizing patient well being in the practice of radiology. Examples of the inhibition of radiation can be through the usage of lead covered parts, such as the doors to the x ray room, and aprons that cover sensitive organs such as the thyroid and the breasts. In conclusion, this introductory lesson has provided a foundational overview of radiology and its application through diagnostic machines. From the fundamental use of high energy radiation waves to the unique capabilities of X rays, CT scans, MRI, and ultrasound, we've explored the diverse imaging modalities crucial for understanding human anatomy and pathology. This lesson highlighted the dual role of radiology in diagnostics and treatment, with a focus on disease detection. We delved into the specific applications of X rays in skeletal conditions, the detailed perspectives of CT scans, and the non ionizing capabilities of MRI in visualizing soft tissues. Throughout the collaborative efforts of radiologic technologists and radiologists were underscored, emphasizing their vital roles in precision diagnostics and patient care. The commitment to patient safety was a recurring theme, emphasizing the meticulous use of protective measures and optimization techniques to minimize radiation exposure. As we transition between imaging modalities and explore the professional roles, this lesson serves as a foundational step for a deeper dive into the dynamic field of medical imaging and diagnostics. Thank you. And here are the sites for the images that I've used, and here are the sites for the websites, journals, and books that I've used. Thank you.